Hi, we are going to tell you about endoscopies in GI surgery. Endoscopy is a device by which we examine internal parts of your body without any cuts. We do what is known as an upper GI scopy or gastroscopy or a gastroduodenoscopy. This is the way we come to know any defect in the upper part of the alimentary tract. This is done with just local anesthesia. It's a OPD procedure. You come in, we do the scopy, and then you go home. What are the indications? Indications are primarily something to do with obstruction to the foods going down your throat. If you have any obstruction in the esophagus, then you see the lower end of the esophagus and you see how the sphincter is moving. Normally in inspiration, the sphincter should close. We also do scopies whenever there is hematemesis, that is vomiting of blood, or if you suspect any growth in the stomach or the duodenum. Epigastric pain can also be an indication for doing a gastroscopy to rule out any duodenal lesion, like a duodenal ulcer or even a gastric ulcer. So these are the primary reasons for doing a upper GI scopy or gastroscopy. Now, this we have seen the upper end of the alimentary tract. For seeing the lower end of the alimentary tract, that is the colon. So if you have a patient who has bleeding per rectum or mucus per rectum or pain suggestive of large intestine pathology, diverticulitis or even CA of the colon, you can use a colonoscope to examine, take a biopsy, and at times you can also use it for doing local procedures like taking out a polyp in the large intestine or any other lesion in the large intestine. This procedure is not done under local anesthesia. We administer total intravenous anesthesia, which is also called TIVA, T-I-V-A, and this is done by anesthetist. Patient is admitted in the morning. Certain medicines are given to clear the large intestine because you need a clear field when you have to see the intestine, and then you do the procedure. Approximately the procedure takes about 30 minutes, but the patient has to come in the morning or prepare the colon at home. We prefer that the patient comes in the morning and we supervise the clearance by giving certain medicines, and then after the procedure, since it's a short anesthesia, patient waits for about 2 to 2.5 hours and then goes home. Biopsy reports are available next day, at the most 48 hours, and you get your diagnosis as what was wrong. So these are requirements whenever you have suspicion of large intestine problem. There is a zone in between the upper GI and the lower GI. That is the part of the small intestine that you need to do either angiography or you can use a gastric capsule, which is not done by us, but we refer it to a center affiliated to us for the procedures. Thank you.